How you feeling? You all right? Did you eat today? Did you have any food?
No.
Shivering?
A little bit, yeah, shivering a little bit there now.
Okay. Anybody we should notify?
Yeah.
Did you hurt yourself anywhere else?
I got a bit of a sore rib cage here, but not too bad.
We'll get you warmed up.
Hi, Joe, is it?
Yes, it is.
My name's Dr. Horwood. I'm one of the doctors here.
Okay.
Can you tell me what happened?
Yes, I was working on the at the rail on the port side there, and something hit me and drove me into the water.
Are you having any pain right now?
Some pain on my left side.
And do you remember if you passed out or not?
I don't think I passed out.
Can you tell me, do you have any allergies?
Yes, I do have allergies.
Do you know what that's to?
It's more environmental.
Okay. Joe, are you on any medications at all?
I take period.
Period. And do you have any medical history?
I have some reflux.
So I can tell that the patient's airway is patent because he's able to speak to me. We're going to have a listen for breath sounds. I don't hear any extra breath sounds. The patient is taking some shallow breaths, so we may not be able to hear everything. Joe, I'm just going to have a feel to your abdomen. Is that okay?
Okay.
Okay, can you bring your arms up for me? You tell me if anything hurts.
Oh.
Really tender there, huh?
Left side's tender, yes.
Okay, even up here?
Yes.
Okay, so I want to have a feel for the pelvis as well. Make sure that the pelvis is stable, and it seems to be. And can you move your toes for me?
Yeah, they seem to be okay.
So at this point, we would log roll the patient, so we would need some extra hands for that. We would assess the spine for any trauma or any injuries, any crepitus, and seeing if there's a spinal fracture. Joe took a really bad fall out there today. Looks like we're gonna have to get him off of the boat pretty quick. His vitals aren't doing so good. I'm worried that he's got an abdominal injury. He could very well have a chest injury. We certainly can't keep him on this boat for very long. Have to give the captain a call and see what he says. Bridge, this is infirmary. This is Dr. Horwood calling. Just wanted to give you an update on the patient who went overboard there earlier.
Okay, I'm standing by here. I'd like to know his status.
We've assessed him. With respect to when he came in, certainly his skin is cool, pale, obviously wet. There was some slight blue discoloration around the lips. His respiratory effort was low. It didn't sound like any obvious worrisome breath sounds, but again, his effort was minimal. He is tender around his left ribs and tender in his left abdomen. There was also a lack to the back of right side of his head.
So, do you consider this to be serious?
Yeah, even after stabilizing him, certainly we've gotten his temperature up with warm IV fluids, and we've got him warmed up with some blankets, given him something for pain. But certainly with respects to requiring the oxygen and the low respiratory effort, the pain in the abdomen, I am worried that he's got some internal injuries. He could have a lung-based injury, certainly some fractured ribs. He could also have internal bleeding from the belly. We really need to be getting him off the ship as quickly as we can, if that's at all possible.
Well, this is going to be a bit of a concern. I'm still about 140 miles off the coast here. We're just getting into some periods of some heavy fog and some snow. We've got a front moving in from the east that's going to pick up the sea state, the wind quite a bit. Altering course, as a matter of fact, to try and minimize the effect on the rest of the passengers. At this point, I had to make the decision that a medical evacuation by helicopter is definitely out.
Any idea how long it could take for us to be able to get him out of here?
If we've altered down with this front coming down on top of us, we'll probably see the sea state pick up in about the next 2 hours. First thing, I'll make contact with shoreside and just advise for the Argentinian Coast Guard to see what they can do for us in perspective of the next couple of days of getting some sort of an evacuation. In terms of available supplies that we need to for the patient, can you advise on what you have there? Like, could we possibly look to have him on board for at least 2 days?
That's certainly a long period of time with potential injuries, but if we are going to have him on board for that long, we're definitely going to need more resources with respects to people at his current state. Certainly someone's going to have to be with him at all times. Also going to need more IV fluids, I would imagine, and lots of blankets in order to keep his temperature up. He's definitely sustained a significant hypothermic episode, so we're going to have to at least work on getting those things.
What we'll do is I'll speak to the chief officer. We'll conduct a search, and if you need any oxygen or additional oxygen, we may be able to requisition those from the emergency supplies for the fire suits. And I'll speak to the chief steward about providing some extra people that may be able to come down and at least sit in while the patient is in the med bay.
And in terms of blankets and other supplies, then we'll make up a list and we'll have the ship searched amongst spares and stores, and
we'll get that to you.
Okay, that sounds great. Absolutely on the oxygen as well. He is currently utilizing oxygen, so whatever we can find on that would be great. So I guess you will give me an update whenever you can?
Yeah, what I'm going to do is I'll make my way down.
I'll call the department heads, the chief officer and chief steward, to meet me down in the med bay, and we'll have a discussion.
All right, that sounds good. I'll be waiting for you here.
Okay, see you in 5 minutes.